Can you share with us your background and what inspired you to specialize in oncology?
Hi, thank you for having me. So basically, I am from a small town near Mumbai. Uh, my schooling was in a school in the same town. My parents were very well educated. My mother is a doctor; she is an eye surgeon. My father was is an engineer, and he was engaged in business. So we had a comfortable childhood. I don't have some very sob story about being a very poor kid sitting under street lamps. We were well off. Our parents did whatever they could. Of course, the limitations of being in a small town were there, but then and it was not a time when you had social media and the internet and you got exposed to a lot of information. I remember we used to go down to Mumbai for every small thing. In fact, I participated in an exam called as National Talent Search. I was selected for it, but we had to go for training from Dombivli, which is about an hour's train journey. Every Saturday we used to go for coaching there and then come back. So for even something as small as that, you needed to actually take the pains of taking the train, going out in the night. Somebody had to pick us up, somebody had to drop us. So these were very interesting times in those days. But very comfortable childhood, very inspiring parents, very supportive parents, and that is I got inspired by my mother, who I saw working for patients and the way patients used to respond. Remember, it was a small town, so patients used to just shower her with love and affection and lot of respect, and that really inspired me, and that's how I got into medicine. Once I got into medicine, I then I got into surgery because that was always what I was interested in. During surgery, I got an opportunity to work in the famous Tata Memorial Hospital, and that really inspired me. I saw cancer being a challenge, not only in terms of treatment but also in terms of surgery. I was awestruck by the kind of surgeries that I saw in Tata Memorial Hospital, and that really got me on to the bandwagon of oncology.
What are some of the most significant advancements you have witnessed in cancer treatment during your career?
Oh, many. So to list, basically, I think we are the lucky generation because we are the bridging generation, as they call. So we have seen cancer treatment really evolve. We have seen cancer treatment being very focused on one specialty, that is just surgery, to now being a multidisciplinary treatment. That means everyone has his place in the treatment of cancer. It's not only doctors, but we also give importance to therapists now. So it's really a multidisciplinary treatment. That was not the case, say, about even 30 years back when I started my career. And this is, I think, by far the biggest advancement that has occurred, that now treatment is truly patient centric. The patient is the focus of the treatment, not only the patient's cure but also his well-being. And I think that change in mentality, to me, is the most fascinating change that has occurred, because that really has bridged the gap between doctors and patients. As far as the specialties go, surgical specialty has evolved from being what we say as big surgeons taking big incisions to big surgeons taking the smallest incisions. That means we have gone from an open surgery era to minimal access surgery. Wherever surgery can be done by smaller incisions, by preserving organs, we now take the pains and the efforts to do that, because we know that is going to impact the patients in a very positive way. Radiotherapy has evolved because there is now better machines, better software. Previously, radiotherapy used to mean that you used to get hard, woody kind of effects once the radiation was given. Now you can hardly make out that radiation is given. It has really evolved very well. Chemotherapy is completely different from the way it was practiced. We hardly had around 4 to 5 drugs to play with. Now there are innumerable medicines available. There is routine chemotherapy, there is targeted chemotherapy, there is immunotherapy, and many such. And this really has brought on the wonderful advancement in cancer care, improving survival, and really making patients functionally fit to go back into the society.
How do you approach developing personalized treatments plan for your patients?
A very good question. Now, how do we really approach patient centric plans? And I, as a doctor, look at it in two ways. One, from the point of view of the patient and his family, and two, from the point of view of the disease. Now, as far as the disease is concerned, a great evolution has occurred in the understanding of cancer as a disease. We now know the molecular basis of cancer in a lot many cancers. We now know what happens in the cell, and that is why we are now able to design very precision personalized medicine and personalized treatments for each individual patient. And this is only going to get more and more focused on an individual patient, and that is where we are heading. As far as the patient and family is concerned, about where they stand from a psychological standpoint, from a social standpoint, and even from an economic standpoint, I think this is something that cannot be ignored, because progress in cancer has meant higher costs, and a lot of times patients are left feeling deprived because they cannot afford the kind of treatment. So we need to tailor the treatment, we need to give them options, we need to tell them the facts about what will happen if they take this treatment, what will happen if they don't take this treatment, if they take the treatment, what are the chances of survival. All this has to be tailored as far as the patient is concerned. And I think that is the key to treating a chronic disease like cancer. It cannot be just textbooks. You have to delve into the patient's personal history, the patient's likes, his entire mental attitude, because that is how, once you get under the skin of the patient, that is how you're going to instill confidence in that patient to beat this grave disease. Because we are going to beat this disease when we work as a team, not as a doctor and a patient.
In your opinion, what role does early detection play in improving cancer outcomes, and what are some effective screening strategies?
Early detection, to my mind, is the key to treating cancer. Remember, cancer is not a wholly preventable disease, though it is 60% of cancers are related to lifestyle. But besides that, nobody can really prevent cancer 100%. So what is the next best thing? Catch it early so that you can treat it fully. Early detection is equal to cure in cancer. Now, how do we detect it early? So there is a method called screening. Screening means using a particular test to the entire population so that you detect cancer early. There are certain screenings that are available. They may not be perfect, they may not be ideal, but we have to get by with whatever we have. And one of them is, the most famous, is mammography, which means screening of the breast for breast cancer, which is supposed to detect more than 90% of the lumps found in the breast. The second most famous is pap smear. Pap smear is for cervical cancer or the cancer of the uterine mouth, and this is something that needs to be done every 3 years between the age of 27 and 50, and then annually thereafter for every sexually active woman. The second thing is mammography. Mammography needs to be done every year after the age of 50 and every second year between the ages of 40 and 50. The test for men is something called as PSA, or prostate specific antigen. It's a simple blood test and is done after the age of 50 annually for detecting prostate cancer. These are the three most common tests that I would like to enumerate, though there are many such, and one has to tailor it according to the lifestyle that a person leads and his or her family history.
How do you see the future of oncology evolving, and what improvements or advancements do you hope to see in the coming years?
It's a very exciting time for cancer treatment. The kind of developments that we have seen in the past few years are overwhelming, to say the least. Recently, you must have read a news that nearly 12 patients got cured of rectal cancer without undergoing surgery by taking a drug which was a kind of immunotherapy. Now, these are the kind of things that are going to become more common. That's what I see. I see a lot of personalized treatment happening in cancer. I see cancer being broken down into a disease of an individual and being treated with specific interventions that can help that individual instead of a one size fits all, which was so far the norm for cancer. And that, I think, is the biggest development that is going to come in the future. We are going to see a lot of artificial intelligence, enhanced reality in surgery and in the allied branches of pathology, radiology, and even radiation radiation treatment. Chemotherapy is going to develop beyond imagination, and sometimes I think cancer may be reduced to a disease like AIDS, where you are going to take medicines and continue living a normal life. We are going to see more and more involvement of very supportive therapies like physiotherapy, like occupational therapy, counselors. These are going to play a very important role in getting cancer patients back to a normal life and a normal status in society. It's becoming a disease which is very common, and now it is becoming a disease which people now talk about openly, and I hope that tomorrow brings a day when patients will not fear this disease anymore.
So, as Dr. Anil Heroor, you mentioned everything that you could. But as Anil Heroor, what is one thing that you think you've been doing or something that you want to do more for creating awareness about the deadly cancer?
In our tradition, there are certain debts that a person has to pay. There is a debt to your guru, there is a debt to your parents, there is a debt to the society. And we have to clear off these run or debts. So, I as a person, I am very aware of that, being brought up in a family which was completely socially oriented. And hence, very early on, I wanted to take some initiative which will bring cancer care in the society, cancer awareness in the society. Because I think the main thing that is lacking in our society is awareness about this disease. There are a lot of apprehensions, there are a lot of misgivings, there are a lot of myths, and in order to dispel all of them, we got ourselves involved into activities which create awareness for cancer. This culminated in the formation of an NGO called GKC Trust, which works in rural areas in order to diagnose cancer early, to create awareness among rural population and the urban challenged population, so that these people know what is cancer and can seek advice in time. We now have a fully equipped mammography bus which has a mammography team in it, which does oral cancer screenings and pap smears as well. This team goes into various rural areas, and I'm very happy to say that we have been able to touch nearly 16,000 individuals and impress upon them the need for cancer awareness. We have done more than 8,000 mammographies, and we have been able to give the diagnosis early in quite a few and guide them to the proper location. We also help cancer patients in whatever way we can by giving them guidance and financial help from our institution as well as other institutions, social institutions which come forward to give help to these patients. So we act as a bridge between patients and various NGOs and various individuals wanting to work in this field. So this is a small way of my trying to repay my debt towards this society which has given me so much.